Any of you know who MacGyver is? Okay. Still no, that's good. We're not ever going to MacGyver someone and stick a pen in their trachea, but you will be treating people who have a trach or maybe have had their trach removed, and so again they may have scar tissue in that area. So it is important to be able to palpate these structures. In a typical outpatient orthopedic clinic, these structures are, unless you're treating post-op patients with a neck problem, you're not going to see this a whole lot. So the first one, that's not in that order, I'm not sure why I have them in that order. The first one is the thyroid cartilage, which is going to be the Adam's apple. So that is going to be shaped like a shield with flattened surfaces on either side. It's going to obviously be more pronounced in men than in women. So Haley, what I'm going to do is come in and put my fingers on your neck like this. Okay. Is that okay with you? Yep. Okay. And what I'm going to have you do, there you go, and go ahead and swallow for me. Okay. So you know that you're on the Adam's apple. I know. So please, 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 if you have kind of stone hands, back off big time for the neck. You don't need a lot of pressure to palpate these structures. If you are on the thyroid cartilage, you are going to feel it go up and down. Just inferior to the thyroid cartilage is the cricoid cartilage. That should not move when you swallow. Now, for people who have a large thyroid cartilage, you may feel some movement in the cricoid cartilage, but it will be far less. And you're also coming off of that shield that the thyroid cartilage creates. Okay, so I'm coming in again. Okay. So I'm on the thyroid cartilage. Go ahead and swallow for me. Nice. So then I'm going to follow the apex of that just down. Go ahead and swallow for me again. And that doesn't move to the extent that the thyroid cartilage did. Now if I go below the cricoid cartilage, I'm going to hit the rings of the trachea. And if you've seen the metal piping that is flexible tubing and you can bend it and you see so it goes like this, right? That's what the trachea is like as well. So you've got the rings and then the tissue between the rings. So when you feel that, so those rings go horizontally. If you go up and down, inferior to the cricoid cartilage, you're going to feel those rings of the trachea. Okay? Now, the hyoid bone, we're going to go up. So we're here on the thyroid cartilage. Go ahead and swallow for me again. Now the hyoid bone, we're going to come in and under. Are you doing okay? Mm-hmm. Okay, go ahead and swallow for me again. Nice. Okay, good. That is going to be a horseshoe-shaped bone. Rock, I'm going to grab the skeleton here. Not that one. Okay, neither one of them have hyoids. It's going to be a horseshoe-shaped bone that resides up in that submandibular fossa. And also, so some of the muscles of swallowing attach to that hyoid bone. And so what you're going to do is put your thumb and index finger into that submandibular fossa, and I can't do it and talk. And then have the person swallow, and that hyoid bone will come down into your fingers. Okay? I know. All right, so let's go ahead and palpate these 4 structures in the anterior neck. Thank you for your bravery. Super prominent. All right. Do you see them? They make a column, the way the facets are oriented. Versus if you get down in the lumbar spine, we have these big bones that we can palpate for. Okay? Why don't you guys get somewhere where you can see? That makes no sense to me. So when I ask you to palpate the transverse processes, you're not really going to be able to find a landmark here. You're going to have to find the spinous process of the segment that you're interested in and come laterally. Now, the cervical spine is quite narrow. So when you're finding the transverse processes, you're not going to come but a finger width, right, to be on the transverse processes. Okay. Do you mind going back and asking her for a fan? Yeah. So, in the cervical spine, the spinous process is going to be in line with the transverse process of that segment. When we get to thoracic spine, that's no longer going to be the case. Okay? But in the cervical spine, it is. But when you get out here, you're not going to really feel much because it's really hard to discriminate the segments. So your landmark has to be the spinous process. Okay? All right, may I have I'm going to start with C2, and what I'm going to be doing is creeping my hands down. I'm always going to keep a finger on a segment that I know what it is and find the next segment. I'm left-handed, so I'm going to do that with my left hand. Once I've found this segment and I find this segment, I'm going to move this finger there and then let this one travel down. Okay? But what you don't want to do is find a segment and then just move your hands down, because now you've lost your reference. Okay? So there's the skull. Now again, I want her to be in slight extension so that her ligamentum nuchae is a little bit in slack. So there's C2. Okay, so now I'm putting my third finger on C2 and I'm coming down, and there's C3. I can't get over your crooked jaw. I need to close my eyes. So I'm on C3 and now I'm on C4. Now I'm actually going to switch fingers because I'm having a hard time with Maddie's neck of sliding my hands down. So I'm going to go ahead and use my other hand and I'm going to keep my middle finger and, no, my ring finger and middle finger are on 3 and 4. And now I'm putting my middle finger on my right hand on C5, and then I'm coming down to C6. Okay? And it feels like we need to test her that C7 is pretty prominent. Okay? So that's how I would do it in supine. Now let's do it in prone. Thanks for the offer. So now I'm palpating the base of the skull. Okay? And now I'm coming down, and there's C2. All right? Now again, I am going to keep a finger on C2. And now I'm on C3. And I'm going to roll my fingers down. Okay, so now I'm on multiple segments. If I wanted to palpate a transverse process, her C2 is so nice, I'm going to come off that. So I found her spinous process. I'm coming out just about a finger width, and now I'm on her transverse processes of C2. Okay. The disadvantage to palpating my middle finger, that's the one I've used for 25 years. So I'm there, and what I'm doing is pressing on one side and then the other, and feeling for a pressure change on the other side. Does that hurt?
No.
Your muscles tighten up a little bit on me on the... Okay, so I'm actually moving C1 this way. Now, in theory, so C1 is going to be the widest vertebrae. In theory, you could try to come down and palpate the transverse processes this way. It's going to be very, very difficult to have a lateral approach for the transverse processes other than C1 because we have a lot of lateral musculature. And so it's just going to be really hard to get them that way. You're much better off doing transverse processes posteriorly and just making sure you're about an inch away. All right? Okay, so you've got spinous processes of C... Oh, no, sorry. Can you sit up for me, please? So I'm feeling here. This is the most prominent spinous process here. So I'm going to put my middle finger on that. Okay. Now, Maddie, what I'm going to do is I'm going to move your head, so if you can just relax your head into my hand. There you go. Okay. That's T1. It's not moving at all. And if I have my hand above her, it disappears and then comes out. So when I was palpating her spine in supine, I added a segment, okay, because I was one off. I thought her prominence when she was down on the table was C7, but it's absolutely not when she's here. You can tell that that doesn't move at all, that that's T1, and that it's one higher. Right?
So is this a better approach to use first to find?
You'll find C7, but if the person has an upper cervical problem, you're not going to get up there because you're going to have all this problem. So if you are suspecting that the person has a lower cervical problem, this is the way to start. If you're suspecting that they have an upper cervical problem, you'd start from the cranium and work down. Someone with an upper cervical problem is going to have complaints of headaches, chronic headaches, and you're going to see them in a posture where they're like this. Lower cervical problem, their complaints are going to be a little bit different. They're not going to complain of headaches as much as they are that their neck hurts. Okay? So based on their symptoms, you would use one approach over another.
Okay.